We're closing in on starting the third year of the COVID-19 pandemic. Now, medical experts around the world, and especially in the United States, hope that the pandemic becomes endemic, something that we'll always have to deal with, but that will not be a serious threat or all that serious. And that could happen in the coming months. And you knew there was going to be a but there are still some hurdles. Hi, I'm Frank Diamond, the managing editor of Infection Control Today. We want to give infection preventionists and other healthcare professionals the information that they need to deal with those hurdles. And here to help us do that is Dr. Kavanagh. If you have been paying attention to what Dr. Kavanagh has been writing about COVID-19 for Infection Control Today, you'll know that Dr. Kavanagh was way ahead of everybody when it came to predicting what this disease would do next. He was certainly ahead of the CDC and World Health Organization. Doctor, thanks for joining us again.
Well, thank you, Frank. Glad to be here.
Okay, I'm going to ask you to gaze into your crystal ball again and tell us what might lie in store. You've written about a recent smallpox scare, and you've written many articles about the importance of booster shots. So why don't we just start there?
Well, I think this virus is entering into a phase of becoming endemic. And we need to adjust our behavior. And one of those is we need to get a booster shot. Now, boosters may actually be just a third course of the vaccine, and it may be part of the normal vaccine course that we'll have in the future. But at least for right now, it is of utmost importance that people get boosters. If you look at some of the countries in Europe, some of these countries are highly vaccinated. For example, Iceland, also Ireland and Gibraltar, where over 90% of the adults are vaccinated, yet they're going through huge surges. And what's happened there is two things. One is that these were some of the countries to first get the vaccine and to get their populations vaccinated. And unfortunately, they have not been very efficient at rolling out boosters. Some of them are just doing it now. And that's allowed the COVID-19 virus to reemerge as immunity has waned. The other factor is when we talk about people who are infected with COVID-19 and whether or not you can get herd immunity, and you talk about numbers of vaccinations within the community, you need to realize that to a large extent, it's not homogeneous on how people are distributed who are vaccinated and not. Those who are not vaccinated tend to clump or gather together in their own social groups, which I like to sometimes call death cults, because they go around spreading disinformation regarding vaccines. But in those groups and those meetings and gatherings, you don't have any herd immunity. They will readily spread the virus. And this is indeed one of the big problems that I think that we have. One is just because 90% of a country is vaccinated doesn't mean that virus won't spread and won't have outbreaks, because we have whole segments of our society which are anti-vaccine. And that is, I think, posing a huge problem. And of course, as we've discussed before, you've got the problem of the virus being into animals and animal hosts. And you can get virus spread from people to animals, and also the reverse. Just last week, there was a report of 3 snow leopard deaths from the Lincoln Zoo in Lincoln, Nebraska. And this was from COVID-19. And also there's a updated report out of, I believe it was Iowa, where 80% of the white-tailed deer were COVID-19 positive. And this follows a report which we discussed in Infection Control Today back last August, where the deer from Illinois, Michigan, Pennsylvania, New York had a positivity rate of around 40% for SARS-CoV-2. So this virus, unfortunately, has also found animal hosts, and that's going to make it even more difficult to eradicate. So I think at this point, we need to plan to live with the virus and to adjust the way that we live so that we can do so as safe as possible.
What is it with the snow leopards? Because I remember, I think you told me about a case of snow leopards getting it about a year ago or over a year ago.
Yes. And the large cats tend to be very susceptible to the virus. And this includes small cats and pets. And it's possible to pass the virus between the handlers and the people who take care of the animals. These cats will cough and sneeze. They don't wear masks, and they can easily spread the virus to those people who are feeding the cats or who are within a closed space, especially during the winter when they may be indoors. They have indoor settings in the zoos where the caretakers are in with the animals. And as we've discussed many times before, this virus can aerosolize. Gorillas and primates are very susceptible to the virus, as is minks, guinea pigs. So there's a whole variety of animal hosts that this virus has besides man, which again, going to be very problematic in getting it eradicated, and also a little scary because, on an evolutionary scale, this virus doesn't need people to survive. And so that means we need to really take this virus seriously.
Does it look like the virus actually kills the animals?
Well, with the snow leopards and the larger animals, yes. On some of the smaller animals, they can get sick, but it may not kill them. For example, we haven't heard of a large amount of deer deaths that have been occurring. The deer apparently live with this quite well, but yet rapidly spread it amongst the herds. And that's actually very problematic, because if it finds a host that it doesn't make sick, but yet it can mutate and change and then reinfect other animals and plus mankind, that is one of the worrisome scenarios that could take place. And so it's something that we need to watch very carefully. If at some point the Department of Agriculture advises on culling the deer herd to try to decrease the numbers so there's not as close of contact with humans, and it may not be as easily to spread between areas and regions, that to me will be a warning sign that this may be something that is becoming more serious.
Why the analogy between COVID-19 and influenza doesn't pan out. That COVID-19 is much worse than the flu. When you hear people talk about, well, if even with 50% of the population, I guess it's now more like 60% of the population with double dose of vaccine, you're not going to get the death rates that you've gotten before. Do you agree with that? And do you think that's germane to the discussion?
Well, I agree with it, but I'm not sure how germane this should be as a major goal, because death is a pretty low bar for public health.
Right.
Long COVID and mild illness can cause devastations to our society. And one of the things that frustrates me is that people really do not understand math. They don't understand long-term effects. It's mainly short-sighted, and their views are very simplistic. And let's compare our SARS-CoV-2 with smallpox. Smallpox will come into a community. It's a DNA virus. It doesn't mutate, doesn't change very rapidly, and it will have a 30% fatality rate. Other members of the community tend to become immune, oftentimes for life, with long-term immunity. So it's almost like, if you talk about banking, it's almost like going out and paying for something in one lump sum. You pay for it, you get it over with. SARS-CoV-2 is more like compound interest. Very difficult to understand. It may just be a small toll in the beginning. And when I say small toll, I'm talking about a 1% fatality rate, maybe 5–10% disability rate, which is really a pretty large toll, but compared to smallpox, it's not as large. But this virus is mutating, immunity is waning, and it's coming back year after year, wave after wave. I mean, who would have thought we'd be entering our 5th wave of this virus, which really makes the idea of herd immunity just becoming absolutely discredited. We've had too many people exposed to the virus. We have too many people vaccinated, and all indications are immunity is not long lasting, so that we have to keep either getting boosters or we have to keep up our antiviral strategies so that we can try to slow down this pandemic. Frank, at a minimum, we've got to keep our healthcare system from being overrun. We can't have 14.5% increases in Medicare B premiums every single year. I mean, that's at a minimum. And then we need to look at trying to get the rates of infection down low enough that people feel more secure in going out and mingling in society, maybe going indoors, shopping, etc. And right now, we're not there. People are still fixated on droplet spread. They have not upgraded ventilation to any big degree. At least in my region where I live, you don't see a lot of people wearing masks. And there's just a tremendous amount of disinformation, both on the severity of the disease and the effectiveness of both vaccines and of wearing masks. This to me is a setup for a disaster. And again, that gets back into more of the compound interest model. People, when you look at it short term, it doesn't seem like it's doing much, but long term, this may be a real problem and a real toll to our society.
I just want to clear up one small point. God knows I misspeak a lot. I think you said in that answer that there's too many people vaccinated. You mean there's too many people not vaccinated? Right?
Yes, correct. There's too many people unvaccinated.
Okay. Dr. Kevin Kavanagh, thanks again. Always fascinating, always entertaining. Thanks again for joining us here at Infection Control today.
Okay, thank you very much, Frank. I appreciate it.